Good morning, everyone. It is my privilege to stand before you today to share a compelling case from the dermatology department at University Hospital Hassan II in Fez. We describe the clinical observation of a 37-year-old female patient diagnosed with metastatic right breast cancer and lymph node involvement. The patient underwent neoadjuvant chemotherapy followed by a RIPAT procedure, radiotherapy, and hormonal therapy as part of her treatment regimen. Notably, the patient began experiencing asymptomatic facial lesions 6 months prior to her initial consultation, with no similar occurrences reported among her family members. Upon physical examination, distinct findings were noted, including a rough pigmented patch measuring 20-25 mm with regular borders on the forehead, along with 2 retroauricular patches displaying a verrucous surface. Given this clinical case, the following diagnoses have been considered: hypertrophic lichen, lichenified eczema, or maybe other. Dermoscopic evaluation revealed a brownish background with curved white lines and dotted vessels arranged in a serpentine pattern, reminiscent of a string of pearls. For the retroauricular area, we can see the same things: curved white lines and dotted vessels in a serpentine pattern. After dermoscopy, the most obvious diagnosis was clear cell acanthoma. Subsequent biopsy was performed, and histopathological analysis revealed an epidermis with a psoriasiform appearance, which means hyperkeratosis, parakeratosis characterized by bland pale keratinocytes laden with glycogen-rich cytoplasm, as evidenced by positive periodic acid shift staining, consisted with clear cell acanthoma. Treatment involved the application of topical 5-fluorouracil for 1 month, resulting in the disappearance of lesion with residual post-inflammatory hyperpigmentation, and dermoscopy showed homogeneous brown pseudo-network and brown dots, white circles corresponding to fibrosis during follow-up. So clear cell acanthoma is an epidermal lesion primarily consisting of epidermal keratinocytes, first described by Degos et al. Previously categorized as a benign epidermal tumor, emerging theories suggest that it might represent a reactive inflammatory dermatosis. Lesions are generally asymptomatic with a slow development period spanning 2 to 10 years. Typically, CCA presents as a solitary dome-shaped papule or nodule ranging from 3 to 20 mm in diameter, often accompanied with a thin colorative scale, and lesions typically arise on the lower extremities. There are several variants of CCA, including giant form manifesting itself as an erythematous plaque measuring more than 40 mm and multiple one with more than 2 lesions. We can see also cerebriform variety, euryptiform, and polypoid form. Dermoscopy can aid the diagnosis, revealing characteristic features such as red dots, globule, coiled vessels arranged in serpentine pattern resembling a string of pearls, corresponding to the histopathology of CCA on transverse sections that indicates uniformly sized dermal island with a string-like distribution and abundant dilated capillaries. For curved white lines, they correspond to fibrosis or collagen alteration in the dermis. Another variant can be seen as a pigmented plaque, and in dermoscopy you can see a grayish veil in the center portion, dotted to globular dark red-black structures mainly located at the periphery with peripheral translucid desquamation, and it is colorated with the red blood cell extravasation and humus-uterine deposits. Despite the clinical varieties of CCA, string of pearls pattern is a common dermoscopic feature that facilitates diagnostics. All reported cases of dermoscopy of clear cell acanthoma have been observed in individuals with fair skin phototypes. However, to our knowledge, our case is the first to describe clear cell acanthoma in phototype 5 individuals with an atypical facial location. Management of CCA typically involves complete removal with various methods available depending on factors such as lesion location, size, and number. Common approaches include shave removal, cryotherapy, topical 5-fluorouracil as we did for our patient, and therapeutic abstention. To conclude, in atypical forms and locations, CCA can pose significant diagnostic challenge, especially for dark phototypes. The string of pearls pattern under dermoscopy significantly enhances diagnostic accuracy. And thank you.